Hello, and welcome to another episode of Improve Healthcare, the show that focuses on ideas and insights to improve the healthcare delivery continuum around policies, processes, and patients. I'm your host, Rich Greenhill. For this episode, we will focus on healthcare delivery system improvement, in particular, some of the policy aspects and considerations with my guest, Ms. Cheryl Kirchner. Cheryl Kirchner is the owner, Chief Executive Officer, and Senior Consultant for WillowTree Healthcare Consulting, LLC. Cheryl has over 25 years of experience in the healthcare industry, which includes system-level healthcare leadership with a specialization in quality improvement, regulatory compliance, as well as directing performance improvement initiatives for acute care hospitals. She has also managed quality projects for Medicare and Medicaid programs and has a clinical background in critical care nursing. Cheryl obtained her Bachelor of Science degree in nursing from Samford University in Birmingham, Alabama, and a Master of Science degree in the Evaluative Clinical Sciences from Dartmouth College in Hanover. She's a certified professional in healthcare quality and served as a Baldrige national examiner in 2013. Her policy management experience includes successful implementation of the RL Datix Policy Stat Document Management Program at a multi-campus hospital system. She also served as a chairperson of the Policy and Procedure Committee for a multi-campus hospital system, and currently leading her consulting practice with services to help organizations improve and stay compliant with document management. So it's my pleasure to welcome you, Cheryl. How are you today?
Fine, thanks, Rich. Appreciate you having me on your program today.
Yeah, it's great to have you. So um, why don't you start by just giving us a fantastic bio? Would you start out by just giving us a little bit about what are you doing over at WillowTree and what are some of the great things you're doing? I saw uh, your undertakings there.
Sure. Yes, we've been quite busy at WillowTree Healthcare, primarily supporting healthcare organizations in their policy management programs. Specifically, I work with RL Datix and Policy Stat, and those customers who are looking to implement and improve their systems and management of their policies and other documents. So that's what we've been doing lately.
That sounds great. It sounds interesting. You know, I've known you for quite a few years, and you are just a giant in the quality industry. So I couldn't be happier to have you. So I want to start out by getting some of your perspectives around, the focus of this podcast is around policy, processes, and patients. And so I want to get your perspectives around how those things are interlinked. How do you perceive that they're interlinked?
I really think that safety is the link, Rich, because to me, the safety is the connection between policies, processes, and patients. And if if you can consider a bridge between the policy management and safety, I would say it's compliance. That's probably where the unity is in all of it. This is something to consider when you think about policies, processes, and patient safety and the culture, behavior, and compliance around this kind of synergy. If policy management and compliance were part of the everyday culture, which was driven by a safety mindset that reflected a shared belief with the risks of the organization, and if people were willing to follow the policies because they believed they were reasonable and they were connected to their personal values and they were part of the policy development and adoption process, then I believe their behavior would more likely drive the culture of safety in that organization. So that's what I promote in my work is that we start with the people and their belief system and the culture of the organization because that will drive their behavior in actually following policies. If they're involved, then they're more likely to follow the policies and be compliant. And compliance leads to safety. If they're doing the right things for the patients will be safer.
Thank you. That's fantastic. And I kept hearing a theme resonating in your comments around engagement. And so, as a critical care nurse, of course, you've worked on the front line and led on the front line and even in your prior roles. So, are there any advantages you see or of engaging frontline staff in policy and in that whole process? You talked about a little bit about ownership.
Yes, absolutely. I would say that there is a great deal of opportunity in engaging the frontline staff in the ownership of policies for several reasons. One is it does support a shared governance model. So, for those organizations who are magnet or seeking magnet status in nursing, this is a direct opportunity to engage those frontline nurses, give them an opportunity to own and develop some policies and network with other peers and with leaders in the organization so that they improve professionally and they have some input into the direct care in their organization. Um, I also think that it's a good idea because it helps promote the equitable distribution of work in the organization. Often, organizations have a handful of people who are responsible for all of the policies that are in the organizations, or maybe you have 10% of the people, or maybe even 5% who are managing all the policies, and it's a burden and it gets behind because they can't handle the workload. So having allowing the frontline nurses to be involved at least in the beginning part and owning the policies, that leaves more time for the managers to do the oversight work, and it balances the work across the organization. And finally, I would say that it provides some objective performance evaluation data for managers. So when you have frontline staff who are owning policies and responsible for, honchoing them through the process, then it is something that managers can use as a performance evaluation metric. And often those can be difficult beyond direct care and communication with patients. It's another metric that could be added to that portfolio of measures to, measure the responsibility of the frontline staff.
Great points. As you were speaking, I was thinking back to my role prior to coming to academia, and I was a chief quality officer at this large hospital care system outside of Chicagoland, and policies and publications management belonged to me and my staff. And so it was my role to make sure those policies were updated, of course, for accreditation. And when you talked about equitable distribution of work, I sort of chuckled to myself because it was my job to make sure that the policies were up to date. And they go through this long process. And oftentimes, there was always a discrepancy with the frontline nurses or managers or clinicians getting to see those policies. And sometimes policies would be changed and the process wasn't always efficient. So I think that that's just marvelous what you said. And also thinking about quality and event triggers. And so when things happen that shouldn't happen or accidents happen, what do you think about those in relation to policy and how policy, is able to, how compliance is linked to managing effectively in those situations?
Yes, I do think that non-compliance of policies can negatively impact your risk and safety program. And I can give you a couple of examples. If you have conflicting policies, let's say you have one unit or department that has a policy that they've prepared, and another department prepares a similar policy, and they're not in alignment, then you wind up with what could be perceived as two standards of care. And so, from a regulatory standpoint, that can lead to risk issues. But probably more importantly, is that if you're caring for patients differently, then if you had a bad outcome because there was inconsistency in how the clinicians interpreted the policy and what was to be done, then this could lead to patient harm. And that would be a different type of risk problem, but for sure a risk problem. So that would be one of the things that I would say could be very detrimental to an organization and have a negative impact.
Yeah, that's spot on. I can recall, updating policies at my last facility, and there was policies that were flowing through, and then not even thinking about the fact that everybody who needed to see it didn't see it. The other thing was that another floor. Maybe they didn't update the policy. Maybe they weren't notified. And so they might have been accidentally using an old policy. And so we often would try to catch those things before Joint Commission and our other accrediting bodies would come through. And you're absolutely right. It's definitely a patient safety thing. And, when the peer review committees meet, they pull the policies, right, and look at the, what were you supposed to do and what did you do? It's just a tough nut to crack to keep all those things updated and things flowing. So this is brilliant. Let me just go ahead. Did you have something?
Oh, yeah, I was just going to say another example is when you might have an unclear policy, and so sometimes it's the content and how it's written. If it's not clear up front and it's not monitored, those could be two problems. So in the planning, it wasn't explained properly, and in the process, it was not monitored well. So perhaps people are following a policy to the letter, but it wasn't written in a way that had the best outcome in mind, and it was not monitored. And so when you go back and monitor and you find, well, they did follow the policy, but this policy is not written to what we would expect in our organization, and the intent was not explained well to the frontline staff, that can lead to another set of potential safety problems or challenges in how the staff conduct their business if it's not a healthcare organization.
Wow, that's great. Well, I want to, for the next segment, to get us to the end here, I wanted to just talk about COVID. I mean, it's obviously what's going on right now. It's the 100-year pandemic, and I'm not in the healthcare setting anymore the way I used to be, and so I know that my colleagues and siblings are struggling sometimes with just keeping their heads on straight. I mean, we hear about it in the news as well. So, from the perspective of policies and finding a policy or procedure in an environment like COVID, talk a little bit about that. I mean, because I think nurses and physicians and technicians are trying to do their very best, and you have a patient that's in coding or in the ER or having issues. You may not have time to go search through all the manuals or online in the shared drive to find something. So, what are your thoughts there?
Yes, you are so right, Rich, because finding a policy or a procedure by your staff is crucial. And even during non-pandemic times, the staff are too busy to hunt down policies and procedures. And so some hospitals have posted COVID policies in different areas of the intranet than their usual policies to make them easily available. And others have organized their policies in a centralized library with a robust search engine. So I mentioned earlier, I work with RLDatix and PolicyStat, and that's one tool that can be used to help make it easy to find COVID policies. You just simply type in COVID in their search terms, and all of them will pop up. So that is, a couple of ways to handle being able to find policies in a hurry.
Wow, this sounds like a great tool. And along those lines, so finding the policy is great, and that is absolutely important. What do you do when there's a lot of changing requirements? As we see, we've heard, and this is not to be critical of anyone at any level of government, but, we in the science field know that things change, right? You figure out today that you should wear a mask, you shouldn't, you wear 2 masks. I mean, those things, as we research, we find out different things. But as that research is unfolding and things start changing, the requirements change. How do you perceive we deal with those kinds of things related to policy?
Yes, I think collaboration, communication, and teamwork are the key words here, because with these rapidly changing requirements, you really have to have dedicated staff keeping their eyes. Everybody has to keep their eyes open. So your quality and safety team, your nurses, other clinicians, physicians, everybody is part of the team in keeping their eyes open for the latest requirements. And then the communication is essential. So once you know that there's been a change, making sure that there is a consistent message from the leadership. I read an article recently about one of the nurses from Virginia who traveled to New York City to help care for COVID patients. She was a travel nurse who was needed to help in the crisis. And she emphasized that flexibility and teamwork were essential in how they worked together, because the nurses and providers there were from all over the United States. They'd never worked together in that hospital, and they weren't really familiar with the policies that there. And so their ability to communicate, although it was a challenge and they was stretching for them, they were able to keep in touch and just had that trusting relationship with each other. And out of their desire to help with each other and help the patients, they were able to get through it. And she said it was actually a very rewarding environment to be in and join a team like that. And so I really enjoyed reading that article and hearing about her story. And it exemplifies what is needed during a crisis, is that the calm professional clinicians who are flexible and agile and able to communicate effectively and really work as a team.
That's wonderful. As you were talking, I was thinking about, I'm a Team Steps facilitator, and Team Steps is just a great way to get teams to work together. And almost feels like everybody should, get trained in Team Steps. I know that some organizations may be doing it better than others, but the teams working together and that teamwork is so important. And, when you're able to bring a group of people together and they're able to coalesce quickly, that is just amazing. And so around the rapidly changing requirements, thinking about, are there any examples out there of rapid, approvals that you've heard of or seen when rapid approval was needed for a change, and how they worked through that?
Yes, I read another article that highlighted the Cleveland Clinic in Ohio and how they set up a new process for rapid cycle approval of their policies. During the pandemic, as new information was rapidly coming out, and they needed new policies and they needed to modify existing policies, and so. According to that team, they created some live documents that they reside within their institution's intranet, and they can be updated based on these evolving recommendations as just part of the practical solution in their organization to help all caregivers have access to the most up-to-date recommendations. So they pulled together their team and they made it available. The team would pull together quickly, make decisions, and they would post those documents immediately, send a notification out to the staff. And that seemed to be a really good method for them. And it was great to hear some good examples of how organizations have been adapting to these new processes. In fact, other organizations have really put a spotlight on policy management during COVID and have made some effective changes. Unfortunately, COVID, it's been a terrible situation for patients and for organizations. And at the same time, it's been a learning period that has forced good change. And rapid cycle approval of policies, it shows that it can be done. It just takes the will to do it. And sometimes a crisis like this can really shake up an organization in a good way to improve the processes.
That's they certainly are a model for us all to look at. And last question before we get ready to wrap up. So let's say I'm an executive, I'm a CEO, or I'm a COO, or a chief quality officer, chief medical officer, and I'm thinking about a policy management program, and I don't have a lot of resources, money. Nobody has more money, a lot of time, and or I have had compliance issues, actual, or I'm worried about having compliance issues. Any thoughts around, what could I do? Where do I start thinking about a way to help shore up my operations for patients, as well as to make sure that I meet those accreditation requirements?
Yes, I think an automated policy management solution is one way to go. And as I mentioned, the RL Datix policy stat is a really great one to consider. As far as lack of resources, you can get so much more done in an organization when you have efficient searching, efficient reviewing and updating of policies. It's all stored. You can see the life cycle of the document. You can really reduce the number of staff it takes to manage a policy program when you have an efficient system that's doing the majority of the work for you. It's more than just a storage system. Policy Stat is a system that helps you automate your management. So there's automatic alerts that remind you when policies are due, and you can put your policies on a review schedule that make it easy to keep up and balance the work over time and not bunch up policy reviews and approval right before your survey may be coming. So for compliance issues, again, this is a way to get all of your policies organized. We've talked a little bit about how non-compliance can affect your organization, but there's actually some positive aspects for policy compliance. In fact, I think it would be very interesting for organizations to consider participating in research studies that show the connection between policy compliance and patient outcomes. We know that when you follow policies, that it will have an effect. There's lots of other competing effects for good patient outcomes, but it would be nice to tease that out. And that's something that RL Datix and Policy Stat have been discussing, is how could we do a research study that tied patient outcomes with compliance. So those are, essentially the answer is consider an automated policy management solution like the one at RL Datix and Policy Stat.
That's amazing. I wish I had known this in 2017 instead of having my assistant at the time have an Excel flat file and trying to run between trying to move things to the quality board and all these other areas where it was just a tough time. So that's a great points. Well, this has been such an insightful discussion, and so if the listeners want to know more about some of the fantastic work that Cheryl is doing and her colleagues, check out our website at www.willowhcc.com. And Cheryl, I want to just thank you for sharing your experience today. It's great to talk to you again. I've known you for quite a while, and so you have and are continuing to make a difference for patients and as well as organizations. And just so proud to be in your network and know you. So
thank you so much, Rich. It was a pleasure to be here with you today.
Thank you.